Okay, class, how are you? So, today we're going to continue our lessons, and the topic of our class today is about the exercise prescription for special population, which is a very interesting topic, especially for the exercise physiologists or exercise scientists in the markets or will be in the future for the markets. So, you need to know how can we prescribe exercise for this type of population. So, okay, class, let's move on. So, the first topic regarding this special population, I'm going to talk about pregnancy and exercise, which is a very specialized area that all the exercise experts need to know about this because pregnancy women are really important to do a regular exercise during this period. So let's move on about how can we perform the exercise or prescribe exercise for this type of population. Okay, guys, on the first slide, I'll talk about what is the importance of regular exercise for pregnant women. So, firstly, we need to ensure that pregnant women are healthy during this time. So, meaning that the exercise can help them to maintain their health, especially it's not only good for the mom, also good for the baby. Number two is regular exercise can provide health and fitness benefit to the baby and to the mama as well. Okay, the third one, because we know that when someone have, especially women who have pregnancy, so they sometimes have a risk with other disease or comorbidity, for instance, like hypertension, diabetes mellitus. So when we encourage pregnant women to do regular exercise, so then we can reduce the risk of developing this type of morbidities. Okay. Well, all right. So it's not something new that we talk about exercise for pregnant women. It's been ages already in the market. So if we compare with Malaysia and the Western countries, we are far left behind. So what we are going to talk today is you can refer that a lot of professional body in America has been endorsed about how can this pregnant woman to do exercise. So according to the ACSM, this guideline has been endorsed by the American College of Obstetrics and Gynecologists, which is specialized for pregnancy women. So it's not only that, it's Joint Committee on the Society of Obstetricians and Gynecologists of Canada, and also the Canadian Society for Exercise Physiologists. So you see that in a Western country who are very advanced on this compared to us in Malaysia. So we need to follow what they are been doing this for many years. So in Malaysia, I think it's something new, especially for my students. So it doesn't mean that although we are new, we cannot promote regular exercise among this type of population, because as I mentioned earlier in the earlier slide, that a regular exercise will benefit for this type of population. So I think this endorsed is not only happened in America, it's happened now already in England, in the Great Britain, Australia. I think they have been advanced about this, and New Zealand and so on. So I think Malaysia can start doing this as well. Alright, I'll give you some examples about in the next slide about what is this. Okay, if you see, I don't know how can I zoom in, but I'll try my best. This basically is a set of questionnaires which is been used in Canada, which most of the exercise physiologists who've been prescribing exercise for pregnant women, they have to use this kind of sheet to help them, so then they know whether they are really or thoroughly make assessment for this type of population or before they begin the exercise. So you can see that if I zoom in, you see that there are 4 sections. If you see on the above, you see like it's coming from Canada. So they designed simple questionnaires that most of the exercise physiologists in the market or in the fitness industries, they can use this. So there are 4 processes, which as you can see, A, B, C, and slightly going down this D part. I think more referring to their agreements to do the physical activity intention. So there are four parts here. Okay. Oh, sorry, my mistake. It's actually three parts, A, B, C, and then each of the part they have many sections. Okay, so must be my mistake. So just ignore my earlier one. Okay, all right. So in this form, you will see that they provide a very good or simple checklist for the exercise of fitness trainers or before they are performing any program for their clients. So you see a simple one, pre-exercise health checklist. So this can be important, so then they know you can see that the question that they ask is really like more referring to the history, whether the person have information about miscarriage in an earlier pregnancy, yes or no. If yes, then there are potentially for this type of clients are very risk to do very heavy exercise and so on. So as an exercise physiologist or trainers, you need to take notes on that, or if necessary, you have to communicate with their doctors whether the person are safe to do this kind of exercise or not. So here you can see that a very strong communication or strong work between the fitness instructors or fitness trainers with their doctors. Okay. And then number 2, you can see the pregnancy complication. So this kind of information they have to ask during at the beginning of starting the exercise. So in the part 2 for section B, you see that they're asking about the status of current pregnancy. So they mark as a checklist, yes or no, yes or no. So all this information is going to help the person to design better and safe exercise program for their clients. So all the fitness industry, especially for my student, which is to be the future trainers in this area. So you need to be prepared on this kind of simple assessment. Although it looks simple, it's only one piece of papers, but it's really give a lot of information. Although simple one, you need to do this. So I think we can talk about this further in next class. All right, let's move on to the next slide. Sorry, I have to reduce a little bit. Okay, let's move on. So this is this next slide. You all have to know the physiological response to acute exercise, especially for pregnant women. So basic vital response, you will see, when the woman have a baby inside the womb, they will increase a lot of energy. They become more fatigued. Why? Because physiologically, I've been work and been affected. I will say that, for example, like oxygen uptake will increase, definitely, because carry a baby inside the womb, so you require a lot of blood and oxygen supply to the baby as well, not only to the mom. At the same time, increase heart rate, stroke volume, cardiac output, tidal volume. So you need to know this, because as a future exercise scientist, it is very important to link the information or the fundamental knowledge about how the physiological response among pregnancy women. Definitely it's not the same like a healthy or normal people. Okay, so you need to know this, then you can able to have more understanding how can you design the exercise are safe and effective for your client. All right, so next what is the exercise testing consideration? So as I mentioned many times to all my students, you cannot prescribe exercise without do any testing, because you doesn't know, you didn't know about what is the baseline of the person. Okay, so exercise, expert, I would say expert or exercise practitioners, testing is very, very important. Although the person who have pregnant condition or pregnancy woman, so you have to do a testing because you need to know where is the baseline. Referring to all 5 physical fitness components, you need to know that, because it's going to be your basis of understanding about the condition of the person. You cannot just like throw everything in the program, like you just try to guess, okay, this will be good, this will be not, so you try everything, which is not really you're not really focused on what is the baseline of the person. So exercise is not like that. Although for pregnancy women you have to perform exercise testing, so although they are must do this exercise testing, so the consideration recommended by ACSM, so as I mentioned in the slide, you will see that don't ever do that. Okay, maximal graded exercise testing, for example, like Boost protocol and so on, which is very, very dangerous, unless it's medically necessary, which is the doctor asks you to do that. Then if you still warranted to do maximal graded exercise testing, you can do that, but it must be supervised by the doctors. Okay, but I think don't do that. To be safe, don't do it. You can do submaximal testing, but it depends on what is your aim, what is the client aim. If the client aim to improve fitness levels, so you can actually use their maximum heart rate divided by the age, and then you know how can you calculate how to improve by percentage. But to predict VO2 max, I think you can do that as well, but you must get again a clearance from their medical doctors to say that they are safe to do this, especially for the women who are very sedentary. If they are fit, for example, that before they have pregnancy they are really physically fit, they went to gym, they do all those things, then it's okay for you to do this kind of exercise. But when it comes to the person who are very sedentary, when you start communicate with them before you are asking them to join the session with you, when you figure out that the person have a very sedentary lifestyle before, as well as they have some medical condition problems like diabetes, obesity, which is very common in Malaysia. Obesity is not something uncommon in our country, is very, very common. So then you need to do all these things, but get the clearance first from the doctors. Okay guys, jangan buat something that you're not sure, and then you need to have a work in hand with either their personal doctors or any doctors, which is need to get more information whether they are safe or not. Because we are work with other health practitioners, we are not work alone, we are not stand alone. Although in Malaysia is something that it's not very practicing, the way we work with the doctors. But I think we're going to move forward with this. I think from time to time, our profession has become very, very important now. So we try to work with that, but that will be not in the topic of our class today. Okay. Alright, we go to the next slide. Alright, what is the contraindication to exercise? This is very, very important. When you find out during session before you start exercise, which is you have more relaxing, interview with them, and then try to get information. Then you start notice that they're having this all. You can see this is a table that I captured from ACSM. Although it's a very old table, it was 10 years ago. Approximately, but I think the concept will be the same. So what you need to see here, make sure that, sorry, I hope you can see that in my slide. Okay, Like for example, like absolute contraindication means that you cannot do any exercise. If you find out that the person have like significant heart disease, lung disease and so on, you can see there are lists there. Cervix incompetency, maksudnya dia punya rahim is not really strong, okay. Multiple gestational risk of premature labor, so you boleh apa kata, dia boleh have a premature labor, okay. Maksudnya kalau dalam bahasa our language is like beranak awal lah. So absolutely no exercise, okay. How to know this? You have to communicate clearly and try to get information with your clients, okay. And then they have persistent second or third trimester bleeding. So bleeding, no way, man, don't do that. It's going to take a risk for the person. Placenta previa, 26 weeks of gestation, okay, and more. You can see that in the list. But that is absolute, meaning that don't do that. Another one is relative, okay. Relative is also contraindication to exercising for pregnant women. For example, like anemia, okay, you mean they have some severe anemia, loss of blood, okay. So and then maternal cardiac dysrhythmia. So a lot of lists here, chronic bronchitis, like batuk kering, for example, poor control, type 1 diabetes. So there will spark a lot of blood glucose in the bloodstreams. So it's quite dangerous. So this is considered as contraindication to exercise, okay. Alright, we go. So next, so exercise prescription. Once you do all the assessments and you can know how can you design the exercise for them. So basically, we in our field, we don't talk much about nutrition and so on, but we're focusing on how to improve physical fitness component, which is definitely you are referring to the simple formula, which is FIT principles, okay, which is first is frequency. At least you can suggest to you can have a guideline when you design the exercise. You put the frequency of doing exercise at least 3 days, okay, per week, okay. But if you feel that they are fit, they are healthy, so you can ask them to do every day if they want, but don't do something high intensity. Go with moderate intensity. How to do that? You can measure 40% to 60% of heart rate, where you can minus by age. Okay. At the same time, how to monitor this intensity? Besides you getting the heart rate from the person, so you can also ask them to use RPE. Okay, RPE is mean rating perceived exertion. So the range of RPE is 12 to 14, so that this range is considered as moderate intensity. So sometimes it's difficult to have heart rate, so to be safe you can do also RPE, or you can do like a top test, how you feel on the lifting or on the set, on the reps. You feel difficult, yes or no. So you need to really close monitoring all these things. Time at least 15 minutes, okay, a day, and then you can gradually increase to 30 minutes a day with moderate intensity physical activity with a total of 150 minutes. So don't jump straight away with 150 minutes. I think it's very risky because we learn about progression principles in doing exercise. So you need to know about how can we progress. So where is the baseline? Is 15 minutes at least. So start with 15 minutes and slowly progress. So and after maybe you monitor about one week, 2 weeks, 3 weeks, you see gradual improvements from your clients, then you can try to reach 150 minutes per week. So how to do that? I think I already showed this in the previous class, that you can just calculate in your own way. Okay. Type, definitely don't go with isolation exercise because it's less benefit. For the person, go with dynamic and rhythmic physical activity, because dynamic and rhythmic physical activity will cause a lot of big muscle involved, and the big muscle involved, definitely more benefit that you will gain. So what kind of type of exercise that referring to dynamic and rhythmic, you can choose either like simple walking exercise or brisk walking, or cycling to be safe. You are not confident someone to do cycling outdoor, can go with cycling in the gym. There are two types of cycling bike. You can use upstrand bike or recumbent bike. It depends. You need to be creative enough to choose which one that's suitable for your client. Okay, I hope this is a simple one. Right. So definitely with this kind of population, there are always a special consideration that you should put in place to ensure that the exercise program is safe for the clients. So if previously, this is actually I got it from ACSM recommendation. If previously sedentary or have medical condition, then you can gradually increase to meet recommended prescription. I think I mentioned this earlier. So you can start with small dosage of intensity or load and then gradually increase. Okay, because you need to know that someone just first time doing exercise, maybe it's being recommended by their doctors where they have too much overweight during pregnancy, so they have to do exercise because when you are big, then you have no energy to support your baby as well as your heart as well. So these kind of things will always recommended by the doctors. Okay, reduce your body weight, So that's why they come into you. So from their previous experience that they are very sedentary, so you need to understand. Start with the very minimal intensity and then gradually increase. Okay. If there are obese, or as I mentioned, diabetes or hypertension, so please get a really clearance from the doctors. Okay. And if the doctor say okay, the person is safe to do exercise, then you can adjust some prescription to meet their special needs. Okay, there are many types of exercise, bunch of exercise in the market, in the books, and in anywhere. So for me, as an exercise physiologist or exercise or fitness practitioners, you need to be creative enough to think about different types of exercise that are safe for your clients. Alright, I don't have to teach you on that. You learn with other subjects. I definitely know contact sports. Avoid contact sport like playing footballs. Now women are playing football, so it's not funny, but yeah, it really happened. Or they play something that very rough. Don't do anything with that because it will cause trauma to the mother as well as to the fetus. So as I mentioned many times, promote exercise are not promoting risk to your clients, because promoting exercise to maintain and promote the fitness and health. So the risk of getting any possibility of injuries, life-threatening, should be reduced or should be in the minimal levels. If good enough, is no risk at all. Okay, but when it comes to exercise, sometimes we never predict what is going to happen. But try to minimal. As long as you can control that, you can foresee that. Try to manage that. Okay. Alright, next is, remember one thing, if exercise should be terminated if any of the following occurs. For example, like bleeding, so, or dyspnea, feeling like difficult to breathe, or dizziness, if you're like, okay, I cannot think much, headache, chest pain, muscle weakness, calf pain, terminated straight away. Don't consider that this type of population like a normal, healthy or athlete population. No, don't do that. Okay, there's no harm for you to stop the exercise. If your clients start telling you, hey, I feel like dizziness, it's like spinning in my head, so stop away. Okay, don't continue. All right, you can continue next day or let them rest. And in the following days as well. Okay, avoid exercise in supine position because it gives pressure to the baby, especially during first trimesters. Okay, so you can modify or you can adopt the exercise like standing, because standing gives more pressure to the muscles in the leg as well as to muscle on the hip, where the muscle important to push the baby. So you can choose, you can prefer this kind of exercise rather than you go with supine position where you give more pressure to the baby, especially when the fetus starts just the fetus just start develop, so it's going to be very risk of doing this. All right, and remember, no Valsalva maneuver. Valsalva maneuver is something like holding the breath while lifting things. No, try to encourage and then try to, guide your client to breathe normally. Okay, inhale and exhale while lifting or not lifting or while walking, because breathing is important because you carry a lot of oxygen. So if you do Valsalva maneuver, oxygen will stop going in and then will affect the fetus, as well as when you contract and then hold the breathing, then give a lot of pressure to the baby. All right, and make sure that the environment should be thermo-neutral, or what we call not so humid, it's not so hot, it's not so cold, just nice, neutral. Because you need to the client with baby need to have a safe or neutral environment, so that they don't lose a lot of fluids in the body, they don't lose a lot of sugars, they don't lose a lot of energy easily. So the best, try to go with gymnasium. Okay, gymnasium usually have that fully air conditioned. In Malaysia, you know that we are so humid, and we are humid meaning that we are easily sweating. So if you put them outdoor without check or without concern about the environment that's too hot or humid, it's going to be dangerous for the mama and baby. So try to reduce all these things. So if you can control, go to the gym and find a gym that really safe. Or I believe that people who are working in the fitness industry, for instance, like the big gym, commercial gym, they have a really good thermo-neutral environment. So I'm not being afraid. But if you are doing some exercise, then you bring them to outdoor. You need to make sure that during afternoon, I think it's not really practical. Or maybe 5 o'clock in Malaysia, it's still hot. So maybe you can start with 6:30, for instance. I don't know. That maybe that weather is really much more less humid, less hot. Okay, maybe that time of period you can ask, okay, let's go with brisk walking outdoor, and then you can do that. But you need to play around with this to observe more closely whether your exercise program are safe or not. Okay. Okay. You can advise as well to take increased calorie intake to meet the calorie cost, because when you exercise, definitely you will burn more calorie. So I will not suggest much on this, because you see I don't put any colors there, because I'm not nutritionist, I'm not dietitians, but our job that we work closely with nutritionists or dietitian. If the person have problem with this, so maybe you can recommend it to them or suggest it to them to do and talk to their nutritionist about how many calorie intake they should eat. Because I believe that some people who are born with ectomorph or endomorph or mesomorph, then definitely if they are some person who are very thin, and then they are pregnant, then when you ask them to exercise, they definitely will reduce their body weight. So the doctor doesn't want to reduce too much. So maybe they can have a lot of discussion with their nutritionists or dietitians. I don't know, but that is what we should suggest it to them, because we work closely with them. So we are, complement each others. But my focus here, I would suggest that you, in the resistance training, it's the same with cardiovascular, you need to incorporate all major muscle groups. Because you don't have to do isolation as like bodybuilding, which is not benefit much to pregnant women. But you need to focus how to strengthen their core, their gluteus maximus, their quadriceps, their pecs, all the big muscle groups will help them to help them for carry a baby throughout 6 months. That is important. Okay. So when the mama are strong, so the baby also being protected. So focusing on all major muscle groups, meaning that you can do functional exercise, or compound exercise, you need to be creative. I don't know what is. I think you know what is these terms. Learn with the other class about compound exercise, functional exercise, because I don't want to elaborate much, because if I elaborate, it will take another 1 hour to explain what is this kind of exercise. But what I want to say, try to focus all major muscle groups. Do not focus much on small muscles, or try to understand about what kind of day they are facing when they have a big muscles in the tummy, have been baby inside. So you need to know when the baby inside the mom, a lot of shift in the gravity, so the muscles will be painful in the back because of constant pressure due to the shift of center of gravity. What happened to the quadriceps? So the quadriceps will start to use concentrically because of the shift are constant. You just imagine 9 months mama carrying all these things. So that's why this kind of muscle you can focus on rather than do some exercise that like bicep curls. So I think that will be less priority. Okay. So last one is postpartum exercise can begin after 4 to 6 weeks after delivery. So if some baby has been delivered safely, so it's faster at 4 weeks after delivery, they can start slowly do exercise. Okay, it depends how much recovery the mama had. So it's not your job to do that, but when they come to you after the postpartum delivery and they say, I want to do this exercise, so you need to figure out whether how many weeks they already delivered the baby and what is their condition now. If they have complication, all those things you need to ask first, whether before you continue your programs. Okay, I think that is all about pregnancy and exercise. So I think we're going to continue in the next class about the children and adolescents. So thank you so much, class. Please post any comments below. So if you have something, feel free to do that. I will try to communicate in the message or in the comment. I try my best to answer. So good luck. Bye.